So I want to give you a little bit of orientation over who we are, and Lana will do the same, and then we'll dive into the work that we've done together this past year. So MedHost is an enterprise health IT company, and we have a patient engagement solution which is called YourCareEverywhere. We're about 600 employees, founded in '84. We're headquartered in Nashville, Tennessee. We also have a large office in Plano, Texas. We provide comprehensive inpatient solutions, mainly for acute care hospitals in rural markets, but we're expanding out of that space quite rapidly as larger systems and clinic groups understand the importance of consumer and patient engagement with the YourCareEverywhere solution. We serve about 5 of the top 7 systems, like CHS, LifePoint, are clients of ours and others. We're in 1,100 customers across the U.S. and Canada, so we have a quite large footprint in the every markets that we cover. YourCareEverywhere is a little unique. People will say, who is your competitor? And I'll say, really no one. When I think about the platform and what it encompasses, left to right, we've got health and wellness content. We integrate with any EHR, so we sit on top of the existing technical infrastructure that any hospital would have with managing chronic conditions or patient through your patient portal. We have a condition management layer so that there's secure messaging, real-time management of goal setting and achievement with groups. We have marketing services because built into the platform is a CRM kind of light solution, so we can segment, profile, and run campaigns and do targeted communications with different groups. And then we have community scheduling that will be rolling out by the end of the year. So when we look at really what is involved in the platform makeup, it's content, so WebMD, ShareCare, Everyday Health. We get the majority of our content through a partnership that we have with Staywell, plus we have about 15 writers that are publishing every day, posting to social channels, more current health and wellness information. We integrate with most every device that you would be using from managing personal health, whether it's Fitbit or Apple Health or your glucometer or your heart rate monitor, those types of things. We integrate with those types of personal health data devices and apps. We have our own patient portal, and we integrate with other patient portals in the market. So if you are consolidating and acquiring a lot of hospitals or practices in your market, this is a nice layer on top that allows your patients to have a unified sign-in experience to kind of the multiple portals that you would service in your market. And then we have marketing services. I mentioned a little bit about that with the CRM Lite. We're not a branding agency. We're not going to give you full profile marketing services and strategy support, but we'll help you target those patients and consumers that are leveraging YourCareEverywhere affiliated with your hospital in a very targeted and segmented way. When you partner with us, it's a co-branded experience as well, so you get access to the full tool set in either mobile or desktop in a co-branded state, so there's a lot of kind of uniqueness that we think the platform offers to the current selection in the market. So I'm going to hand it over to
I'm going to have you, Leah, play our video, please. Introduce Jefferson Community Health Line.
What happens when a hospital becomes more than a hospital? When we connect to our communities by combining healthcare with Lifecare, we make healthy living easier to embrace for everyone. Imagine possibilities when every interaction becomes as much about our patients' lives as it is about their health.
Thank you, Leah. That is a brief introduction to Jefferson Community Health and Life. Next one, number 7. There we go. Jefferson Community Health and Life is a small rural hospital. We started in 1963 and started as the county seat of Fairbury is county seat of Jefferson County. Started because there were lots of little clinic hospitals in that day and age, and the community decided that it wanted a hospital to serve the entire area and to serve the entire community. We have grown over the years, although the population of our county has not. We're in Fairbury, Nebraska. We have a population in our county of around 7,000, and we serve pieces of all of the counties next to us. We are a 17-bed critical access hospital. We have recently renovated, and we have all private patient beds now in our acute care. But we have also grown over the years to the point that we have the 40-bed long-term care was always with us. That was always a part of our facility. We have a community fitness center that was added in 1996, and our board was really a little bit ahead of the game on looking at community fitness and trying to make sure that we were a part of people's lives in the wellness aspect as well. The family medicine and outpatient services is the most recent thing that we have added. We for years operated as a hospital which had a physician's clinic that was totally separate than us, owned by the doctors, 4 physicians and 2 PAs, and a little over a year ago we purchased that. We now have 250 employees, and our new mission is to inspire healthy living by providing exceptional healthcare services to every person, every time. Some of the things that we have determined over the years that are really critical to survival of a small critical access hospital is strong branding, community outreach, obviously, community engagement, being a part of the lives of the people in our community. And we've always worked at that, but with our new branding initiative, we have worked even harder at that. A commitment to an excellent quality of care, and when you look at our quality numbers, we're up there with the large hospitals that are in our state. Professional staff, so they're all very well trained, very competent in what they do, but they also have a heart for caring, and they know the people that they are caring for. And most of all, I think what we have learned in the last several years is it's really important that we are willing to try new things and we're willing to think outside the box. As of 2016, we had just purchased this practice, which for years and years had been a separate business. They still do not have a provider portal. That's down the road, and it will happen. They do still operate from paper records, so that is a difficulty for us. Acquisition of the clinic, though, really did position us very differently in our market. We had a brand new CEO, had just been on board a couple of years, with a lot of new ideas and a lot of willingness to try things. A strong brand. We were strong in our community, and people knew us to be the healthcare center in our community. Patient portal was not implemented. It was available to us, but IT department had not ever pushed it forward any more than whatever number they had to have meaningful use that year. And employees didn't know there was a portal. Employees didn't know what a portal was. So with our renovation, with the addition of the clinic, with everything that was going on, we knew it was time to refresh and reestablish our brand, to educate our employees on the things that were available to us and to branch out and to use the portal. And then, lo and behold, we found out about the YourCareEverywhere platform. And when we were working on a new brand that we wanted to be a part of people's lives, even more so than we ever had, YourCareEverywhere was the perfect solution for us. We did a phased launch approach. In 1963, our name was Jefferson County Memorial Hospital Incorporated. And that got really clunky at one point. We decided we were never county funded. So we did change our name in the 90s to Jefferson Community Health Center. And in 2015, the other thing we had going on was a very, very fragmented, brand. So, okay, the logo on the left was our hospital logo, our health center logo, Jefferson Community Health Center. The next one was our fitness center logo. Fitness center is part of the hospital. Why we did a separate logo, I'm not sure. Gardenside is our long-term care. They're a part of the whole health center as well. Again, we allowed it, but they had a separate logo as well. So out in the community, we have all these things going on. And the Fairbury Clinic, when we purchased them, of course they had their own logo as well that they were very proud of and thought that was the be-all and end-all. What we did was decided we really needed to be one brand. We needed to be unified. We needed to emphasize our strengths together, and we became Jefferson Community Health and Life. I don't think I missed anything important back here. Reflecting our community commitments to inspire healthy living, and that is really what we try to focus on, and YourCareEverywhere has helped us to do that. So our goal has been to create programs and projects that really show people that we do want to help them stay healthy. We do want to be a part of the fabric of their lives. To expand the reach beyond our walls, and I know you've all heard that a lot over the last 2 days, but by being out there in the community, by going to businesses to offer services and education, by being at the places where people are, and we keep working on ways to do that. Our senior diners meets on a monthly basis, and we now do a monthly program for them about something that's health related. Obviously the older market isn't the hardest one to reach, but we've also taken on doing some things with schools. In December, we're going to be hosting an elementary family night, and if y'all want to come, we could use help. We're going to have approximately 300 young'uns and their parents in 2 different sessions, taking part in fitness and health activities in our facility. So that's not really reaching beyond the walls, but it's bringing in people who aren't normally necessarily always there. And to leverage the tools from YourCareEverywhere and My Wellness Dashboard to be able to do that. Also want to strengthen employee engagement, and by creating some internal committees to define who we are and to think about the things we can do, that has really involved our employees. We've added health coaches. We have emphasized the health coaches that we already had. We are working with our community on a new walking trail project, which in our community is a big deal. We now have one mile of walking trail, but we want to expand that. Offered incentives that we had never done before to women who were having their mammogram and their physical in our facilities. We've done a women's health fair for the first time ever, and it was a great success. And we've expanded our fitness center services and tried to listen to what kinds of classes people were asking for and what kinds of services they wanted. We announced our name in January of this year. We introduced the Wellness Dashboard to employees first and really encouraged them to get into it, to look at it, to let us know what their questions were, because we knew when we went out to the community, they were going to have the same questions our employees did, and even more so perhaps. YCE came to us and they did a 2-day training with us with all of our staff who would be involved in answering questions and working with the community. We have an ongoing committee, and there's still more that we want to do, so that committee is still working. But it involved not only IT, but nursing, our nurse informaticist, outpatient clinic, lab, radiology, health information services, myself and PR, all the different departments that were really going to be touched by going to the community with YourCareEverywhere and My Wellness Dashboard. We partnered with YCE to develop scripts for people so they'd have the answers that they needed. They developed with us some co-branded collateral, and one of the things that was really nice is they worked with the agency that we were using for the branding. So it was great to be able to have Joy on the phone and Julie on the phone and me on the phone and talk through. So when the materials were developed, everyone was happy with them and they did what they needed to do. And we did encourage our staff to be early adopters. Now, not all of our staff are yet signed up. We're still working on that. But again, we tried to make sure they were asking us the questions that they had so we could kind of see what questions the community would have.
So part of the communications package, we're just passing around one of the rack cards, and what we did is we offer printing support for the facilities that use YCE with the collateral package that we put together that's co-branded and customized based on how your patient throughput is. But and Jefferson actually has their own printer in market that they use, so we provided them with the files. They were able to have everything printed and manage inventory and stock on site and within the relationships that they have within their community. But these are basic assets. As we toured around various hospital partners of ours in the lower mid-market rural space, access to resources, access to really nice branded materials weren't there. It was clip art and copy machine a lot of times. So we felt like it was important for the facilities to have the materials that they needed to not only look like a unified brand, but explain what YourCareEverywhere is, because it is a little bit different of a value proposition. So we created posters, rack cards, table tents. There's an enrollment guide that we created. We did some custom work just specifically for the employee audience during that pilot phase as well. In addition, we looked at all of the entry points that a consumer and patient would have to get to YourCareEverywhere and to create their wellness dashboard. So looking at organic traffic through social advertising that we did, through YourCareEverywhere, when people come in through their zip code, their geo-identified, with Jefferson being the affiliated hospital in their network area. Once selected, everything is a co-branded experience from that point forward from a consumer's point of view. Same with the patient. If you come in from a Jefferson website to sign in for your patient portal, it's a co-branded experience moving forward. And the nice thing about other markets that are really looking at the wellness dashboard is this consolidation tool, because it is EHR agnostic. Jefferson actually has our EHR, but you don't have to have our EHR to get the benefit of having the consolidation resource tool that the wellness dashboard provides. We also did a 4-series email campaign to patients explaining YourCareEverywhere as well. So part of our patient portal, like everybody else's activation series, is you provide your email address, sign the release at admissions, and then you receive an email from the patient portal system to set up your account and select your password, all that type of basic information. At that point, we start to communicate with them about what is YourCareEverywhere, what is your patient portal, what is a wellness dashboard, encouraging them to download the app, because all this information is accessible in the mobile view as well. And then what we found, of course, is click-through rates that were significantly higher than industry standards, so we're really pleased with that. It also provided Jefferson with some information around email as a communication option, because they had not previously done any email communications with their patient audience as well. So we're really seeing that the audience is engaged with that channel delivery.
So, we launched our new website in late April, and up in the corner, it's very easy to go to My Wellness Dashboard from our website. It's also very easy for people to get from My Wellness Dashboard back to our website if they choose to do that. We also focus on an informational aspect of My Wellness Dashboard front and center. So we're really trying to encourage people to utilize this as a tool. We're not one of the big hospitals in our area, so we can't have our own wellness website that has all of that wonderful content and information, but YCE can provide that for us.
I think what's nice is how you positioned it. It's all around, we're here to look at your whole life, not just when you have an incident with us inside our facility. And that wellness dashboard and how you position it really made that clear to why I would want to join a wellness dashboard if I wasn't a patient.
Exactly. You're healthy, but there's great things. We did our first Health and Life community celebration event in May of 2017, and actually it's a great time to do this. You've got to all play along. I'd like everybody to take a pin. Nice. And I would like everyone to take a card. Very nice. When we had our Health and Life Day, one of the things that we did was we had everyone who came, everyone who attended, we had a big board. and it had the health pledge that's on the back of the card that I'm giving you. I only need one of those because I can't say it by heart.
Oh.
Save me one. I didn't memorize it. We had the health pledge on this big board, and everyone who came in signed the board. And when they signed the board and took the health pledge, they got to have a pin. So here's how you have to play along today. I would like everyone to say with me the Healthy Living Pledge. I pledge to live a healthy life by making exercise, nutrition, and preventative health care part of my regular routine. In doing so, I will enhance my physical and emotional well-being, and I will inspire others to do the same. Here's to a lifetime of health. And when I have gone out, as we are talking to our local Rotary and Kiwanis and Optimist and those things, as corny as it is, I've given them all cards, and we've read the health pledge together, and I've given them each a pin. But that's really the point we're trying to make, is we want to all be inspiring each other to live healthier lives. For our Health and Life Day, we brought in a rock climbing wall, we brought in some inflatables for the kids. That was all out on the front yard. We had a bike rodeo where somebody checked each kid's bike and made sure it was safe. We had bike helmet fitting. They got little prizes for going through the little bike rodeo. So we also did a lot of adult-related things and gave away things like Husker football tickets. People have probably burned them by now, but that's a whole other story. If you're not a Husker fan, you don't know how miserable we are right now.
Was that on your property, all these activities?
All these activities were on our property. So it was, again, bringing people to us. We're really trying to do a combination of going to people and bringing people to us when they're healthy. At our county fair, we did a demonstration of My Wellness Dashboard. Everybody who signed up for it was eligible for a drawing for a Fitbit, and so we drew for a Fitbit from that, and that generated some more people to sign up for My Wellness Dashboard. And then we decided we needed to do a new little take on it, and a new challenge. And many thanks to YourCareEverywhere for helping to brainstorm what it was we could do. We've had a physician who's left, so we're working on recruitment. Some staffing shortages, so there's some potential patient leakage going on. We do a Smart Moves lifestyle change program every year, and we always try to funnel people into this year-long lifestyle change program. It's designed particularly for those with prediabetes, but it would be available for anybody who was interested in living a healthier life. And we were planning a women's health fair for the very first time for the end of September. So we got together and we brainstormed and said, what can we do to best use the resources you have and the things we need to do and engage with our community and our employers. We decided we wanted to get people to learn more about diabetes and know whether they were at risk, and give us an idea to learn more about the state of diabetes in our community, and also drive people to the Smart Moves program if we were able to do that. So we did a corporate challenge. It did increase the pre-enrollment for our Smart Moves program. We have 12 to 15 in the current session. We used it to help increase attendance at our women's health fair, and we had, for the very first time we've ever done it, we had 175 people. Understand there's less than 4,000 people in my whole community, so some of you might think that's a small number, but we were very pleased. We wanted to drive additional YCE affiliations, so get more people to sign up for that. And so we provided a prize to the business that had the highest participation.
Yeah, we decided to do a corporate challenge because none had ever really been done in the Jefferson market before, so we thought it would be a nice first-to-market advantage. We have a diabetes health risk assessment that is through a partnership that we have with Evalia, so we were able to create these kind of very unique landing page experiences for both employers, for the Jefferson employee base, because once we started brainstorming around the idea, Lana was like, well, can we participate? And I said, of course you can, but you shouldn't participate with your employers.
Yeah, we couldn't win.
So you can't take the prize away from them. So let's create a separate challenge for your employees as well to keep them engaged, and then do something completely separate for the patients, because we do have a substantial number of patient emails, so let's make sure that we're also looking at them from their pre-diabetic state to see what learnings we can gather and feed them into the Healthy Moves project or program that you have. There were 2 steps to the campaign. We had 3 landing pages. They had to first complete the HRA, the health risk assessment. At the end of the health risk assessment, it provides you with a very detailed, about 10 to 12 page printout, PDF, specifically about how you ranked your risk level based on various questions that are based on the Farmingham study. So it's a very clinically accurate risk assessment for the people that are participating. So we wanted them to complete the HRA, and then we wanted them to set up their wellness dashboard, because within the wellness dashboard there's a layer where you can store all your personal health information, like immunization records or results from health risk assessments. So there were 2 parts to be able to qualify that employee as a fully vested participant within their employer base. So there were 2 parts to it. We also created these communication packages, so it made it easy for Lana to go out and enroll the employers. We weren't asking for their email addresses. We were asking for them to send the emails out to their employees. Some of the challenges we ran into, given the size of the community, is they just didn't have email addresses on there because these were, card punching employees, so they didn't communicate with them except through the lunchroom with a poster. So we created a poster, and we created other communication assets that could be used by the employer to really engage with their employees about the opportunity. And it was all around, we care about you as an employer, and we care about your family's health. So help us, know what your risk is by taking the risk assessment. It's all confidential. It's all personal to you, and should you choose to take it to your primary care physician and share with them your risk level, we encourage you to do that, or bring it into Jefferson during the upcoming health fair that they had. We also did an email campaign. Once we got someone to the landing page and they completed part of it, we went back and retouched those people that fell off, who were only maybe completing the HRA but not completing the wellness dashboard, to make sure that we could really boost all of that qualified participant number throughout the program. So unfortunately this shows up really dark, but the image at the background is the community setting, so it had a very familiar kind of user feel. And we asked for name, employer, we asked if they were full-time, part-time, contract. We encouraged them to forward it to a friend or family member as well, so that we could kind of expand our reach. And there's all different types there. Of course, the corporate had a different call to action than the employees, because their prizes were different. And we did not give a prize to a patient, just so that you know how that worked. We also had, I mentioned the poster for the employer. They got a Krups machine for their break area, which they were thrilled about. For the employee at Jefferson, we chose an Amazon Echo Dot, and then, of course, the landing page for the patients as well. So within the companies, we had 4 corporate participants that represented several hundred potential employees. We were able to complete 56 HRAs. We did emails to those that did not complete the wellness dashboard to boost those numbers. So we had 41 wellness dashboard completions. For the employees, we had 26 take the HRA and 26 complete the wellness dashboard as well. This is just an example of the 2 communications that we sent out to increase HRA participation plus wellness dashboard completions. The patient emails, you can see the click-through rates are very strong. The wellness dashboard reminders, 1 and 2, that went out to the those that had only done step 1 and not step 2. Again, really strong click-through rates, really helped increase our total completion. And then the HRA reminder. So we're very pleased with what the email component did to re-stimulate someone who may have gotten busy at work, whatever. We all get distracted when there's a 2-part series. So in the end, this was a completely new program for Jefferson, but we drove almost 100 HRA completions, so we're really proud and excited about that. Pre-event, we had, from all the activities that we had done to date with Jefferson, we had 126, so we rose to 186, so we had about a 60 count increase, or 32% increase over that 2-week period that we ran the program. We were also have, and we continue to offer the health risk assessment through Jefferson's website for any organic traffic that comes in, but there's no competition or prize associated with it.
And we are actually promoting that again for November for National Diabetes Month.
Yeah.
So encouraging the public.
We also noticed increase in the health fair attendance. We ran the corporate challenge 2 weeks before the health fair, with the winner announced the day after the health fair. And we had a encouragement and a booth at the health fair where people were encouraged that attended to complete the HRA and their wellness dashboard. So we saw Lana saw a significant increase in just attendance at the event, which was also very positive. It was our inaugural event. We had 4 large employers, and about 50% of the target companies in the market that Lana had targeted participated in the event, so she was pleased with that. Employee participation also was good. I think, always when you are in an employer role, there's often turnover, there's new employees that are coming into the organization, so programs like this help to do that additional training on some of the existing assets that might not be known. And then we were able to also acquire a significant new number of emails. We went from 275 to 379. We are looking at additional email programs in 2018, like e-newsletters. That's the importance of really growing that email database for us, so that we shift the cost off of print into things that are more digital and efficient for Jefferson.
There's a shot from our first ever Women's Health Fair. As I said, we had 175 people come. We are looking at the possibility of going to a different venue next year, because we did pretty much fill up the space that we had, both of our conference rooms. We had activity in our fitness center, and this is actually our front lobby that you see. But women had a great time. They participated in the speakers. They had speakers on all different life stages. We had everything from immunizations to urinary incontinence to posture to menopause, and one of our local physicians actually had the guts to speak about women's libido. So, Dr. Rick Jr. And it was quite an interesting talk, and the women who were there really enjoyed it. There were plenty of places for them not only to get health information but also to shop. So it was a very successful evening, and we definitely want to do it again in the future, and definitely want to use the email possibilities from YCE to continue to promote that in the future.
So, at the completion of this, we spent some time just really going back and looking at Jefferson's relationship with YourCareEverywhere, and I think Lana spoke in the beginning about there was a patient portal. It was implemented through IT, often how patient portals are implemented. Other departments in the hospital didn't even know about it. And so when we came into the picture, we visited Lana in late 2016 and started to share with her the YourCareEverywhere a platform that she didn't realize that they had the opportunity to leverage. And we put together this plan of, okay, going through the rebrand, who do we want to engage with first, really using our employees or using the Jefferson employees as our advocates. Critical that they really understood how the integration with patient portal happens, the importance of the wellness dashboard, so that anyone basically in the organization, not just registration, could speak to the benefit to both the patients that were there and then out in the community. And then you can see the steep incline. We've been very happy, and I think Lana's been very happy, and their CEO, with just the payoff. They're seeing the importance of having community tools that allow them to stretch their brand out into the market in a meaningful, compelling way. And the fact that the data is really aggregated, it does provide a very utility value proposition to their both patients and consumers that they're trying to reach. So, you know, I don't know, you want to talk to some of the things that you learned?
Sure. It really has been a win-win for us. It has been, because we've got the YourCareEverywhere platform and the My Wellness dashboard, it really does help us reach out to our community and work on engaging them in a new way that we just didn't have available to us. We didn't have the tens of thousands of dollars to go out and build something like that, and weren't really quite ready maybe to reach out to the large competitor who might have that kind of a robust website. So it really has helped us to try to connect healthcare with Lifecare and to show our community what else is available. It used to be that when women were expecting, there was a book that you gave them. Well, they don't do that anymore. They go online. And YourCareEverywhere has that in a life stages section that they can go and they can see what's going on this week. And so we promote those kinds of things. It definitely, doing the corporate challenge has strengthened our employer relationships and helped us to learn a little bit about some of the employers that aren't yet to that point of electronics, and we're still brainstorming on some ways to work more with them. Definitely has improved event attendance, and we'll continue to use the emails for those kind of things, and increased enrollment in our Smart Moves program. We've got 12 to 15. There's actually a few since I gave you that number.
Great.
These were our local winners of the Keurigs. Our local library has 5 employees, and 100% of them did the challenge and completed it successfully. The one to the right is our Fairbury Public Schools. The public schools is one of our largest employers with somewhere between 200 and 250 employees, and they had something on the order of 30% participation. And the school nurse actually saw me shortly after the challenge and said, okay, I'm sorry, but I'm really kind of tired of people saying to me, oh my goodness, it said my diabetes risk is high, what do I do? So I'm funneling her some information also to share with all of those employees. And then our JCH&L winner who won an Echo Dot was one of 25 or 26 employees who hadn't been signed up before and did the risk assessment. So we felt like it has been really successful.
So I hope this was an enjoyable.
How are we doing on time, Leah? Okay,
enjoyable
questions?
15 minutes, oh, perfect. And we're happy to take any questions that you might have.
How does your patient portal work with EMRs? Like, we were going with one that couldn't handle the complexity of our system because we're a giant critical access. So we had to go back to that. So we have 3 patient portals. If you were in from A to B time frame, then we switched over. So if you were B to C, then you had this one, and now we're D to E, and then like even some of our doctors haven't even switched over. So technically, depending on how you go through, you could have records in like 5 different patient portals.
Wow, crazy.
Yeah. Yeah.
So we have 2 ways actually to facilitate the kind of EHR agnostic integration. One is technical. Our technical team would meet with yours. We would do a secure API one directional feed into patient portal. The other option is the patient or consumer, when they set up their wellness dashboard, can aggregate all their login information, and we have a single sign-on capability on top of that. So they have single sign-on into that portal area within the wellness dashboard. So that's single sign-on for all your portals, their dental portal, their other specialist portal. The other thing that the wellness dashboard will be launching by the end of the year is the ability to have like family members. So you set your own patient portal up. You may be the caretaker for elderly parents. You can set up a file with all their patient portal links and all their personal health information. Same for a child. So it really becomes multi-dimensional in how you can apply it within your particular situation. Again, all under how do we take healthcare information and really marry it with life stage, life care information in one solution. So I'm not going to
Yeah.
14 different URLs to try and figure
Yeah,
out.
our biggest thing is actually getting people to do it. We've tried to work with IT on a flow chart, but
Yeah.
because of how it is, no one really on IT is like.
So yeah, we would preload, and when you partner with us, it's all co-branded, so it would be preloaded in their instance of the wellness dashboard if they're a patient. So they're not having to. Your technical people aren't having to figure it out. It would be kind of interfaced through the wellness dashboard.
Thank you.
Yeah. Yeah.
What would be considered a good open rate for email? I noticed you mentioned like the 27 and 29%. Sometimes senior management, like if we get 25% or 30% open, they'll say, but 70% didn't open it, but that's just kind of how email is, right? What
Yeah.
would be a decent range of an open rate, would you say?
So the industry standard, I believe, is like 3 to 5%. So when you're getting 20,
That's the
industry
average?
standard.
Wow.
So that's why we're really happy with with the open rates that we've gotten to date. So, and again, it's personalized information. It's not, you're getting spammed with a new sale at Dillard's. I mean, it's stuff that you have through your profiling exercise when you register for YourCareEverywhere. We understand your preferences, and then when you've affiliated with the hospital, you're only getting information that they think is important for you to know about. So it's pre-qualified in a way.
It's also like a targeted versus
very targeted,
general
very
public.
right.
So that's why you're probably getting the 27,
Yes.
29%.
Yes. Yeah.
Yes.
Yeah.
So does your hospital or any of the employers you work with have an ongoing employee wellness program that this then turns into a larger tool? So you just gave the example of a challenge to get enrollment up and to do that health risk assessment, but ongoingly, how does this tool fit into the wellness platforms for your organization?
Our hospital does have a wellness program for our employees. We use Simply Well. We encourage people to utilize the wellness dashboard as well as Simply Well. Simply Well gives us some things to do employee wellness-wise that the wellness dashboard does not do, but the wellness dashboard gives people some opportunities for information and keeping all their medications and all of their allergies and all that information together for their own medical record that Simply Well doesn't. So we really try to use them together. The businesses that we worked with for the corporate challenge, some of them have something of a wellness program, but in none of them is it very formal. And in all honesty, that's one of the things that we hope that this gives us some open doors to move toward, is to be able to work with these larger employers for a wellness program that we could help them to facilitate. We could come and do the blood draws for them.
Right.
We could help to line them up with the information. So that's part of the plan.
So, and what's nice is we're not in competition with those employer wellness programs. We kind of would sit on top of it like another layer, like your patient portal layer. We have a condition management layer. So if there is an audience like diabetes that you're trying to manage that condition in a controlled group with clinical, real-time visibility, coaching, we have a layer specifically for condition management. I would just see a layer for the employer wellness program, but those are just pieces of me trying to manage my health and wellness in my life. So having those consolidated within the one view in the wellness dashboard is helpful from a fragmentation problem as well.
Yeah, we have a pretty strong health base, and so wellness programs is one of the things that they're always asking for and always interested in. Or, what tools can we help kind of share or pass on to them to bolster their wellness programs?
I would think YourCareEverywhere would be a wonderful tool to share with them.
Right.
That would.
With the content, we've got recipes, exercise programs, videos. There's like 30,000 pieces of content that are there, and we have a staff of writers, so it's always growing and relevant. So you personally can say, I only want stuff about men's health. And that's how your content experience is going to be oriented as well. So,
Any others?
well, thank you very much. We
Thank
have a
you all.
table.